Hello, my name is Darin. I'm one of the physical therapists here at San Joaquin Valley Rehab Hospital, and I'm going to be doing a short talk on the spinal cord and spinal cord injury. The spinal cord is a long, fragile, tubular-shaped structure that extends down from the base of the brainstem to the lower part of your spine. It is comprised of nerves that transmit incoming and outgoing messages between the brain and the rest of your body. The spinal cord is housed in the vertebral column, 33 stacked individual spinal bones or vertebrae with intervertebral discs made out of cartilage that help provide cushioning and flexibility to the spine. From top to bottom, we have 7 cervical vertebrae, 12 thoracic vertebrae, 5 lumbar vertebrae, and 5 fused together sacral vertebrae, and 4 fused together coccygeal vertebrae. Out of these regions are pairs of nerves that extend from the cervical region, 8 pairs of cervical nerves, 12 pairs of thoracic nerves, 5 pairs of lumbar nerves, 5 pairs of sacral nerves, and a coccygeal nerve. The spinal cord itself ends at about the level of the L1 vertebrae. So the lower lumbar and sacral nerves first must descend down the spinal canal before exiting, and they resemble a horse's tail. That's why they're also known as the cauda equina, which in Latin means horse's tail. When the nerves emerge from this vertebral column, they emerge as 2 small roots. There's an anterior root and a posterior root that come together to form the nerve. The anterior root is also known as the motor root. That transmits commands from the brain out to the rest of the body, primarily to skeletal muscle. The posterior root carries sensory information from the body and transmits it to the brain. I now would like to talk about spinal cord injury. Spinal cord injury is any injury that does damage to the spinal cord that results in some degree of loss of strength, sensation, and other bodily functions below the level of the injury. Spinal cord injuries happen for a number of different reasons, and they're classified as either traumatic injuries or non-traumatic injuries. A traumatic spinal cord injury is caused by an abrupt blow to the spine, damaging one or more vertebral bodies and the spinal cord itself. Common reasons that someone might sustain a traumatic spinal cord injury include motor vehicle accidents, falls, gunshot wounds, stab wounds, sporting activities, and recreational activities. Then we have non-traumatic spinal cord injuries, which are the result of internal damage to the spinal cord, often caused by osteoarthritis, tumors, cancer, inflammation, and infection. Your ability to move your limbs after a spinal cord injury is primarily related and based on 2 factors. 1, where along the spinal cord the injury took place, and 2, the severity of the damage to the spinal cord. The severity is also known as the completeness. So spinal cord injuries are classified as either complete injuries or incomplete injuries. In a complete spinal cord injury, there is loss of motor and sensory function below the level of the injury. In an incomplete injury, there is some spared motor and sensory function, but it can be variable on how much is preserved. Additionally, the paralysis that's a result of the spinal cord injury can be classified as quadriparesis or tetraplegia and paraplegia. In quadriplegia, all or part of your hand, arm, trunk, and legs are affected, where the paralysis in paraplegia, just part or all of your trunk and your legs are affected. Your healthcare team will help determine the level and the completeness of your injury. They oftentimes use an assessment scale called an ASIA exam, where it will be assigned a score between ASIA A, B, C, D, or E, with ASIA A being a complete injury and ASIA B, C, D, and E being various levels of incomplete injury. When someone sustains a spinal cord injury, they have questions about their recovery. Usually one of the first things they're going to ask is, will I be able to walk again? Usually with time, they'll also be thinking about other things, their ability to dress themselves, bathe themselves, how are they going to transfer? The doctors and therapists and nurses that typically work with spinal cord injury patients can help predict someone's functional outcome. And the functional outcome for everybody is going to be different. Some people may need the use of a power or an electric or power or manual wheelchair to get around, while other people might be able to walk with leg braces and canes. Some people may need help with every aspect of their daily care, where other people will live a completely independent life. The main factors, again, that are going to influence someone's functional outcome is the level of the injury along the spinal cord and the completeness. In addition to that, other factors that will impact someone's functional outcome will be their age, their fitness level before the injury, and other medical conditions.